disease. For a patient, it takes away their ability to live their daily life. In severe cases, they're not even able to do things like put on their shirt buttons, walk, go for a walk, go out to do some basic activities. They may even need help to go to the toilet. It is a chronic disease and it requires the highest level of expertise. Whether it is medical management, assessment, or something advanced like deep brain stimulation, we have an extensive team of experts led by Dr. Dinesh Nayak, Dr. Nigel, Dr. Satish, Dr. Praveen, Dr. Arul, and Dr. Praveen, all of them, including our latest youngster, Dr. Venkat, who has actually worked in neuro rehab and neuroimmunology. So we have this extensive team which helps patients as per their condition to live their life in the best possible way. Since Parkinsonism is a chronic disorder, it requires the quality of life to be maintained to a patient. That is the most important. And that is what our team does with a lot of expertise and passion. On this occasion, I would like to thank our chief guests for gracing the occasion and would like to appreciate the excellent work being done by our team. Thank you, Dr. Dinesh Nayak, Dr. Nigel, and your entire team. And I'm sure this program will be a grand success. Thank you very much.
Thank you so much, sir, for enlightening us with your words. It's an honor to invite Dr. Dinesh Nayak, the Director of Neurology and Advanced Center for Epilepsy, to give us an overview of Comprehensive Parkinson's Disease Clinic.
Sorry, I stumbled, but we are again picking up. Very warm good afternoon to all of you, ladies and gentlemen, members of the press. I extend a very warm welcome to all of you. I start off by welcoming our chief guest, Mrs. Sudha Mayappan. You know, she started the support group for Parkinson's disease way back in 2014 with just 6 members, called Parivartan for Parkinson's disease. And now they have more than 250 members. They meet every week, and it's a huge movement. And this is the right time for our patients to, to get exposed to the kind of care that we can all provide for our patients with Parkinson's disease. I think that's a wonderful service that you've done, ma'am. Thank you very much. It's a great honor and a privilege for us to have you here today. I also welcome our members of the press, without which the activities that we do has to get dissipated among the general public, and we play a very important role for this. So thank you very much. I also welcome our Dr. Alok Kullar, our CEO, Madam Lakshmi Mishra, our medical director, and Mr. Bhaskar Reddy and his team, our marketing people. So I think this, without their help, it is impossible for us to move on. Now, I would like to focus on the very important point of how teamwork is important from the point of view of how to provide a 360-degree coverage for our patients with Parkinson's disease and other movement disorders. Now, not many centers have this kind of extensive teamwork that we have, and I'm proud to say that this is a working model, a living model. We do it on a day-to-day basis, on an everyday basis. It is not an individual, but it's a team effort. And I would like to name each one of our team members who helped in this the comprehensive Parkinson's disease clinic that we are going to launch today on the occasion of the World Parkinson's Day, which is happening on, which is falling on April 11th. Now, I would like to emphasize our team members. From the neurology side, we have Dr. Satish Kumar, Dr. Praveen Chandar, Dr. Venkatraman, who's going to lead the Parkinson's disease clinic itself, and Dr. Lakshmi Narayan, our pediatric neurologist and epileptologist. So all of us work together. Our neurosurgery is headed by Dr. Nigel Sims, Dr. Arul is there, Dr. Chamandeep is there. So they are a very active group. Neurocritical care, this is very important. So we all fall under one umbrella. Neurocritical care again by Dr. Ramanan, Dr. Prasad, Dr. Mohana, Dr. Nitya. They all form a very important component of the neurocritical care, and we all function together. Not just that, but we need to have some very important, Parkinson's disease and movement disorders. It affects not just the physical aspect, but also the mental aspect sometimes. And we need to have a good psychological and a psychiatric care. And Dr. Siddhika Iyer provides that for us. And then we have a very important, you just heard Bhumika talk about, rehabilitation, physical therapy, occupational therapy, the importance of that. So we have Bhumika, the physiotherapist, and a team, and then we have Gauri, who's the occupational therapist, Vaishnavi, who's the neuropsychologist, and Lakshmi Priya, who's the speech therapist. So now Parkinson's disease, when we have to do some very advanced work on Parkinson's disease, we also need to have the setup. Now this setup is, you need to have a very good neuroimaging service, without which it is impossible for us to plan with great accuracy how to reach the target when we do the DBS, how to diagnose different kinds of Parkinsonisms. Parkinson's disease is not just a single entity, it has got multiple different entities, and it's the expert who can tell that this is idiopathic Parkinson's disease, this is a Parkinson plus syndrome, and so on and so forth, or Parkinson's with dementia complex, or so many other conditions are there, which are called mimics of Parkinson's. So it requires a lot of high degree of speciality and expertise and knowledge. And we need to have a dedicated neuroimaging center. And that's where it's provided by Dr. Dinesh and team. Shiv Shankar is there, Balasubramaniam is there, and there are so many other people. And the Parkinson's disease is a disorder of, we were telling about it, it's a disorder of dopamine metabolism. We have the functional neuroimaging, which is a very important specialty of our place. So we do what is called TRODAT scan, we do the DOPA scans, we do the FDG PET scans. All these facilities are available in our place. Again, Dr. Arvind heads it, and Dr. Sharath is there. So you can see that, this is the kind of team and the teamwork that is needed to push this Parkinson's disease in a very comprehensive manner, right from diagnosing Parkinson's, making a differential diagnosis of Parkinson's, and then medical management of Parkinson's, which requires a lot of expertise in how to titrate different medications. Sometimes you may have to withdraw medications to make the person better. When you see a list of so many medicines, you withdraw some medicines, they become actually better. So that requires expertise. And then in those patients who unfortunately, have side effects due to the medication, they are very good candidates for, not all of them, but a significant sub-proportion of patients with idiopathic Parkinson's disease are good candidates for deep brain stimulation surgeries. Now, that is a very important point that we have. And our strength is basically that where we apart from the medical work, which is very, very important, that's the bedrock of the Parkinson's disease clinic, but the surgical aspect, which is the DBS. So that's why we say that it's a 360-degree coverage that we have. And today, we are blessed to have our patients with us who have actually undergone this DBS surgery. Mr. Sampath is there, Mr. Gauri is there, and Mr. Padam Jain, and Mrs. Ramabai, they all come all the way. And I must also welcome Mrs. Vedi Ravi. Now she has come, she has started a blog on Parkinson's disease, and she's also written a book on how to handle, patient care for patients with cancer. She's also planning to write a book on Parkinson's disease, caregiver approaches, etc. So that's very important. Thank you very much, ma'am, for coming. And so without our patients, we are nothing. It is the trust that our patients have on us. That's the reason why we are all here. And I must thank our management led by Dr. Alok Kullar. Without the management, without Dr. Alok Kullar's support, who has been a pillar of strength for us, without which we cannot progress further. And he and his team has allowed us to function in the way in which you are actually functioning. That is very important. Individuals may be brilliant, but it's a collective effort that ultimately benefits the patient. It's not a single man's or single person's brilliance that can take you. It can take you some distance, but it's not going to take you all the distance. With that, I welcome you all and thank you very much for being here. Thank you.
Thank you so much, sir, for your words. Now I would like to call upon Dr. Venkatraman Karthikeyan, consultant neurologist, to give an overview about Parkinson's disease.
Yeah. Good afternoon, everyone. I'm helpless, but I cannot move without thanking our chief guest who's made all this way through the scorching sun to grace this occasion, and also our special guests who are these Parkinson's warriors who have put a brave front. They've gone through the DBS surgery and they're leading an excellent life. And it also is not possible without the management led by Dr. Alok and the marketing team to put up such an event of launching a comprehensive Parkinson's disease clinic. And it's always a special event when it's graced by the press and the media people. Thank you all. So much of the representation which will show. Yeah. So much of my talk has been already introduced by the previous speakers, both the CEO and my head of the department. So it just makes it easy for me to reiterate the things which we are about to see. So my talk is about why we need a comprehensive care system. You know, when we see a Parkinson's disease person, it's not just the medicine and the effect. We need to just see him as a holistic. He's a human. He's not a person where we give the medicine, see the effect. It's not a system. He's a human. And the human has a lot more demands than the medicine and output. So we need to, so just an introduction about the Parkinson's disease, some of which slides have already been covered by Bhumika in her previous talk. You know that, now this slide, what I'm going to modify and say is, when we see a Parkinson's person from outside, we see that the person will have a tremor, he may be slow, he may stoop, but that's not only what he undergoes. That's something which we see, but there's some things which may trouble him more than him or her, more than that. So they may be having problems with sleep, they may be hallucinating, they may be having problems with the bladder and bowel, their moods can be changing, they will be having a balance issue, but that is going to be the major problem because these balance issues leads to fall and then leading on to other complications which would make him hospitalized and lose his confidence. So who is going to take care of all these things? Is the medicine alone a cure for this? No, actually not. So this needs a lot of reassurance and a team working around them. So they should feel that they are under safe hands. They have to feel that they are being cared by not only one person, but a group of people who are going to take them forward in their lifetime. Now you see this, most of these Parkinson's people they're almost in their age of retirement or they're retired. So the rest of their life, they've run all their life, they've worked, they want a peaceful and a best quality to spend whatever savings they have, and when this disease strikes, it's a horror. So we have to think them as a holistic person, and that's where this comprehensive service is going to make a difference. Now, such a person enters a hospital, sees a neurologist. The neurologist has a task of doing certain things. Now, Parkinson's disease is a highly clinical diagnosis. There are many investigations in neurology to diagnose for other conditions, but Parkinson's is a call by the neurologist. You are branded Parkinson, it's basically based on his call. You may have a PET scan, but nothing comes close to the clinical decision. So you have to make a good call on the Parkinson's disease. More important is ruling out the mimickers. That is going to make a big change in explaining the road ahead for the Parkinson's disease. Now, what can you expect at 3 years from now? What can you expect at 5 years? How will the medications change your course? When will your medications start to play around with your disease? Everything can be decided just by this right diagnosis and ruling out the mimickers. And then the medication starts, and starting the medication is just the start point. You'll have to run a lifetime with them. You'll have to be with them throughout. You have to be ready to answer any amount of questions and take them through this process as long as they live. And then with this, any clinic at that level, any clinic can do that. Now, where comes the level of an institution is where you provide a comprehensive service. And then it only doesn't stop there. You have to introduce them to self-help groups like Parivartan. That is because it's always, when you are diagnosed with a disease, you are all alone. You need people to talk to, share your thoughts, ask them how they are doing better. And most of the times, it's not only the patient who gives the idea. We learn from the Parkinson's people as to how they manage their symptoms. We propagate to the next Parkinson's patient. We connect people, and that is how the mental well-being also improves. But the take home or the important thing is achieve the quality of life. That's what we are doing. That's where we are heading towards. Now, there are certain challenges in this road ahead. Now, as we know, we can broadly say there are motor or movement symptoms and the non-motor or non-movement symptoms. These motor movement symptoms are the tremors, the stiffness, the slowness. The non-motor movements or non-movement symptoms are pain, mood disorders, balance issues, bladder, and constipation. Now, whenever a patient is diagnosed with Parkinson's, he has already lost at least 50% of the neurons, which secrete a hormone called, to put it hormone, or it is called the neurotransmitter called the dopamine. When we are already diagnosing them, they've lost 50%. And from there, the process actually is going to continue until the late stage where the neurons are going to keep on getting loosed. So that is a challenge which we are going to race against when we are starting them on a medication. And the next challenge is medication works only for the motor symptoms. It may not be that great for these non-motor symptoms. So we'll have to actually anticipate our shortcomings, and that is where we have to rely upon a team to deliver the other areas where the medicines will not go and act, and that is where the comprehensive service is going to make a big change. Now, how this model is like this. A neurologist becomes a central pillar, and then he gets inputs, he gives inputs to, for example, the psychiatrists and psychologists. If whenever the patient is going through a mood swing or whenever they're having a psychiatric hallucinations, we need them. And then the major thing, balance issues, which is going to cause a fall, may lead to fracture. We have to prevent that. They're going to be arthritis. These are people who are getting into their 60s. They will have arthritis that is going to even more impede their walking ability along with the Parkinson's. They have muscular pains unexplained due to the non-motor behavior, and an exercise program needs to be done by physiotherapists. Parkinson's also can have a cognitive issue which needs to be dealt with a cognitive therapist who works in liaison with the neurologist. And it's not only the therapist and the team, we'll also sometimes require our other specialties like a urologist whenever they have you cannot control with your own medicines, you need to bring the urologist for your bladder issues. A gastroenterologist for whom the constipation is so severe that you're not able to overcome with your own medications. Sometimes at the end stage, people may develop pressure sores, plastic surgeon is required, and an orthoptist to plan their walking aids and everything. So now you can see how just a team is going to help this neurologist who's going to pillar or anchor the Parkinson's care. But just imagine this same picture without this and only the neurologist working. It's going to be difficult, especially as the disease progresses. Now I can show you, so this can easily tell the entire picture. Now the Parkinson's disease, let's assume there are 3 stages, the early stage, the mid stage and the late stage. When the patient is diagnosed early and when you put them on a medicine, the medicine goes from an off stage or a low voltage. I'll put it this way, an electrical stage where a low voltage means he's dull, he's slow, he's having tremors, he's having stiffness. The medicine, once it starts and it takes him to the on or the normal stage, where the person is normal as he used to be before. In the early stages, this on stage with the medicine is going to be a long time. So the people be very happy. Okay, I'm fine with the medicines. But as the disease progresses, as we saw in the previous slide, that the neurons keep degenerating, the number of neurons available become less. And when you give the medicine, it may either offshoot, or you take the medicine, you will not get any benefit. Or whenever you take the medicine overshoots its job and it just causes unwanted movements, like you will be keeping on dancing, your limbs will be moving. It feels an embarrassment in front of others that you are moving unwantedly. This does not give a good quality of life. And you can see that the on stage or the normal stage has become very narrow. So this is the time period where the people want to be, but they are not able to be. And this cannot be stopped, but can be prolonged when you introduce activities like physical exercise and exercise programs tailor-made for the Parkinson's. It's been scientifically proven that this physical exercise programs can postpone or delay the degeneration of the dopamine neurons. But once you reach this condition, this is the time you may be a candidate for an advanced Parkinson's therapeutic program, which includes the DBS surgery. And later we may go to a dependent stage where it will be more of an off stage, and there again it's not without a team's work, where we need more therapists to step in to keep them in a good frame of life. So to sum up, PD is a work in progress. It doesn't stop. You need to keep on changing. You need to keep on thinking. You need to keep on titrating your medicines. See what the patient needs and what stage they are in. A neurologist, being the central pillar, cannot work without his colleagues to get the best quality of life for the PD patients. A comprehensive services is not only going to handle the complication, but may be good to slow down the progression of Parkinson's disease. And with the advent of the advanced Parkinson's disease programs like DBS, we can change the outlook of the Parkinson's disease and give an independent life for the people with Parkinson's disease fairly in their advanced stages also. So this is what we are looking at. You can see the neurologist being the central pillar, the therapist and the dietitian joining them in the early stages. But as the stages proceed, when there is some issues with the cognition and the mood, the psychiatrist steps in. And then if for a selected patients, if they are well good enough to go in for the advanced program, the neurosurgeons comes in, and there you stand up independently to achieve the pot of success when you are going through the Parkinson's care. Thank you all for the patient listening.
Thank you so much, doctor, for explaining the Parkinson's disease to us very well. Now I would like to request Dr. Nigel Sims, the clinical lead and senior consultant neurosurgery, to talk about deep brain stimulation and management of Parkinson's disease.
A very good afternoon to all and a very warm welcome. Respected Dr. Alok Kula, CEO, Mrs. Sudha Biyapen, our chief guest, Dr. Lakshmi Mittal, our medical superintendent, Dr. Dinesh Naik, head and director of neurosciences, Mr. Bhaskar Reddy, head of marketing, our Parkinson friends, Mr. Sampath, Mrs. Gauri, Mrs. Ramabai, and Mr. Padam Chand, colleagues, friends, and the press. A very warm welcome to you all. I'm just going to talk a few words about deep brain stimulation, what I would like to call as a pacemaker for the brain, which is very similar to the pacemaker for the heart. So first, let us have an idea as to why Parkinson's disease is such a problem and what is the burden of the disease. As you can see, there is an estimated 7 to 10 million people worldwide which are living with Parkinson's disease. And as our life expectancy increases, the incidence of Parkinson's disease also increases. And look at that, 4% of all the people with Parkinson's are diagnosed before the age of 50, so it affects the young also. Men are 1.5 times more likely to have Parkinson's than women. And today, more than 150,000 patients have benefited from deep brain stimulation worldwide. So what is deep brain stimulation? So it is basically 2 electrodes which are inserted into the brain. I'll just go back. Yeah. So 2 electrodes are inserted into the brain which are connected via 2 leads, and this is connected to a battery in the upper part of the chest. So this is what it basically consists of. Now these 2 electrodes in the brain, when the battery is on, it jams the abnormal signals in the brain, what we call as hijacking, and activates the failing system. So what are the benefits of deep brain stimulation? It improves the motor performance by more than 70%, and it reduces the medication by up to 60%, and thereby reduces the side effects from the medication. And overall, it improves the quality of life. Now, why is it such a problem? Because as we mentioned earlier, you see how much it costs from loss of work, treatment, social security, loss of income. It costs the United States nearly 25 billion per year alone. And as you see from this slide, as the life expectancy increases, the numbers of patients with Parkinson's by 2030 is going to nearly double. Now, who all are patients who are suitable candidates for deep brain stimulation? What are the indications? Parkinson's disease, which is responsive to levodopa medication, those who are having severe motor fluctuations, wider on-off or the yo-yo phenomenon, those who are having severe dyskinesias, tremors uncontrolled by medication, painful dystonias, and wearing off spells with extreme slowness, and side effects from the medication like psychosis and vomiting. There are some expanded indications also for deep brain stimulation, which has been approved by the US FDA, that is PD for at least 4 years. Motor complications not adequately controlled. It has to be levodopa responsive, and motor complications for a minimum of 4 months or longer. As we mentioned earlier by Dr. Venkat, the evaluation is mainly first done by a consultant functional neurologist and a consultant functional neurosurgeon. The psychiatrist plays an important role, followed by a neuropsychological assessment, a consultant anesthetist, and a clinical practitioner consultant. So there is a big team which is involved in the overall treatment of this patient. And this is our deep brain stimulation team. As you can see, we are a large team. Now, what is the equipment required for deep brain stimulation? So we need a MRI. We have a 3 Tesla MRI available. We need a CRW frame for inserting the electrodes, and that's the frame. We need a CT scan, and of course we require the electrodes, the battery, and the lead. And this is our navigation station, which we use to calculate the target points. And in the operation theatre, we need all this complex equipment for inserting the electrode in a very precise location. The nucleus is the size of a rice grain into which the electrode has to be inserted. That is the level of accuracy required. And then we have a recording equipment for checking whether we are in the correct spot. And all this equipment is available here at the Gleneagles Global Health City. What are the steps? There are more than 100 steps involved in this surgery. It starts with fixing of the frame on the morning of surgery, followed by the patient having a CT scan. And that CT scan is merged with his MRI scan, which is done with the frame on. So the CT and the MRI are merged, and then we calculate the coordinates, and then the electrode is inserted, And this you can see is the post-operative MRI as well as the CT scan showing the position. And of course the battery with the electrodes. Now, considering a procedure which has got more than 100 steps involved, which requires to be extremely accurate, the side effects and the complications, if it is done properly, are very minimal and is around only 2 to 3%. Because some patients are scared when you talk about putting electrodes into the brain. So what are these side effects? One is the patient can have a small hematoma, there can be infection, can be post-operative confusion, anxiety once the battery is on, they may be a little emotionally unstable, may have some memory impairment, walking difficulties, and then concerning the battery, it may get drained or there may be some circuit problems. But all of these are all in the range of only 2 to 3%. Post-operatively, patient is given a charger which he will be taught how to use, and he has to regularly charge his battery. And when he comes for follow-up, we have a programmer where we're able to check the settings and whether things are all in the right direction. What is our goal at the Gleneagles Global Health City? It is the establishment of our comprehensive Parkinson's disease clinic, which we are doing today. For it to become a center of excellence for DBS, it should be available and affordable to all sections of society, to set up a data bank of all our patients, to have a fellowship program, and last but not the least, some research work. And this is the team in Adelaide, that's Professor McDonald and the neurologists who I trained with. Can we play the video, please?
Centre. We're really pleased that you're starting deep brain stimulation in July. We wish you all the best from the Adelaide DBS team. And I know you'll be a great success. You've had excellent training, and so we wish you and your neurologists and patients all the very best. And we're very happy to be a supportive team in Adelaide and interact further with you. So congratulations and all the best. DBS in July.
Thank you very much. And two celebrities who are well known for having Parkinson's, famous Muhammad Ali and MJ Fox. Thank you very much.
Thank you so much, Doctor, for elucidating us about deep brain stimulation and management of Parkinson's disease. Now we have come to the most important part for today's program. Here comes an exciting part, the unveiling of our comprehensive Parkinson's disease program by our chief guest, Ms. Sudha Mayappan, followed by, I would like to request our patients, the team of doctors, our CEO, Dr. Alok Kullar, and Mr. Bhaskar Reddy to please join us on the stage for the unveiling program. Dr. Lakshmi Mishra, ma'am, please.
Okay. நீங்கள் செட் பண்ணாங்க டிஸ்கிரிப்ஷன் நீங்கள் கரெக்டாக பண்ணியிருக்கீங்க பேக்ரவுண்ட் கரெக்டாக இருக்குது இது போதும் எழுதுவாங்க
சார் கொஞ்சம் டவுன் பண்ணு பஸ்
I would request our patients to come forward on the stage for the same event. Mr. Padamchand, Ms. Gauri, Mr. Sambar, Ms. Ramadevi, Ms. Veni, please join us on the stage. Decrease a sense of isolation that people affected by Parkinson's and their family experiences. This initiative was born from her personal intense caregiving experience for her father, who suffered brain hemorrhage. She believes that her contribution to the society. Ms. Sudha also works as a full-time economist, learns and teaches yoga, is a student of Vedanta, and fiddles with the instrument Veena. It's our privilege to request
this at all. I just stumbled into this because of my father's ill health, nothing to do with Parkinson's again. But over the years, when all of you were making the presentation today, for every point you were mentioning, constipation, slowness in walking, dyskinesia, I could only think of all the members of ours who are suffering from those symptoms, So every symptom is personal, every story is very affecting for me and my coordinator who is here. So without taking much of a time, especially for the benefit of the press. Sir, நான் தமிழ்ல பேசவா இங்கிலீஷ்ல பேசவா அவங்க எல்லாத்துக்கும்? தமிழ்லயே பேசவா? Best சார். கொஞ்சம் ஸ்டாட்டிஸ்டிக்ஸ் நான் சொல்றேன். Just try to just keep this in your mind, சரிங்களா? இப்போ பார்க்கின்சன்ஸ் இப்போ இது இந்த வருஷம் இதுக்கு முந்தின வருஷம் ஒரு ஏப்ரல் மாசம் வந்தா ஒரே பரபரப்பு. எல்லாரும் பார்க்கின்சன்ஸை பத்தி பேச ஆரம்பிக்கிறாங்க இந்த டைம்ல. ஒரு 8 வருஷம் முன்னாடி ஒரு காக்கா இதை பத்தி பேசாது. நாங்க மட்டும் தான் ஏதாச்சும் ஒரு 2 நியூஸ் பேப்பர் கூப்பிட்டு சார் கொஞ்சம் பார்க்கின்சன்ஸை பத்தி எழுதுங்கன்னு சொல்லுவோம். So the awareness has increased a lot these days, thankfully, thank God. And what Global is doing with this comprehensive program is amazing. We need something like this. And இந்த மாதிரி நிறைய தேவை. ஒன்னு சொல்ற எல்லாரும் கேட்டுக்கோங்க. கிட்டத்தட்ட 95% இல்லாட்டி 98% of people affected with Parkinson's முதல்ல வாட்டி அந்த வார்த்தை பார்க்கின்சன்ஸ் எப்ப கேள்விப்படுறாங்கன்னா ஒரு டாக்டர் உங்களுக்கு பார்க்கின்சன்ஸ் இருக்குன்னு சொல்லலதான் இந்த மாதிரி ஒரு நோய் இருக்குன்னே அவங்களுக்கு தெரிய வருது. பாத்தீங்கன்னா உலகத்திலே இது 2வது பெரிய நியூரலாஜிக்கல் டிசார்டர். இது இதுக்கு கியூரும் இல்லை, ஆனா இதை பத்தி யாரும் கேள்விப்பட்டதில்லை. So as press, it becomes very vital that you carry stories on Parkinson's very frequently. சரிங்களா? 2வது, இப்போ எங்க மெம்பர்ஸ்ல பாத்தீங்கன்னா கிட்டத்தட்ட நான் ஒரு 8 வருஷமா ஒரு 400 ஃபேமிலிஸ் கிட்ட பேசியிருப்பேன் affected with Parkinson's, either person affected directly or somebody in their family. இதுல கிட்டத்தட்ட 80 இல்லாட்டி 85% எல்லாம் ஆண்கள் தான், 20% தான் ஃபீமேல். இதுல இதுக்கு முன்னாடி டாக்டர்ஸ் எல்லாம் சொன்னாங்க இல்லையா, இது வயசானவங்களுக்கு வர்ற டிசார்டர்னு. நீங்க பாத்தீங்கன்னா எங்க மெம்பர்ஸ்ல கிட்டத்தட்ட 50% இல்லாட்டி 60% அஃபெக்ட் ஆனவங்க தனியா இருக்காங்க. அதாவது அவங்க சில்ட்ரன் வந்து ஒன்னா அப்ராட்ல இருக்காங்க இல்லாட்டி வெளியில எங்காச்சும் இந்தியால இருக்காங்க, கூட இல்ல. So imagine a picture now. You don't know what this disorder is. You're already old, வயசாயிடுச்சு, உங்க வைஃப்க்கும் வயசாயிடுச்சு, குழந்தைங்க யாரும் கூட இல்ல, இப்போ பார்க்கின்சன்ஸ் இருக்கு. Now what do you do with a disorder like this? It's a very serious problem. So ஒரு கம்யூனிட்டி அவேர்னஸ் இல்லாம, ஒரு கம்யூனிட்டி சப்போர்ட் இல்லாம இதை டீல் பண்றது ரொம்ப ரொம்ப கஷ்டம். இப்ப எனக்கும் தனலட்சுமி எங்க கோஆர்டினேட்டருக்கும் சம்பத் சருக்கு அவரோட சன்னுக்கு எப்போ கல்யாணம் ஆச்சுன்னு எங்களுக்கு தெரியும். கௌரி மேடமோட குழந்தைங்க என்ன படிக்கிறாங்கன்னு தெரியும். So we know individual cases of what is happening in the family to be able to help them deal with the disorder. We had a talk with Mr. Sampath saying, should he do DBS before his son's wedding or after the son's wedding? You know, decisions like this become very important. இன்னும் ஒரு கேள்வி, கிட்டத்தட்ட எல்லாருமே எங்களை கேட்கிற மோஸ்ட் ஃப்ரீக்வென்ட்லி ஆஸ்க்ட் क्वेश्चंस அப்படின்னு ஒரு லிஸ்ட் போட்டா இதுதான் டாப்பா வரும். எனக்கு ஏன் பார்க்கின்சன்ஸ் வந்தது? எனக்கு நல்ல லைஃப் ஸ்டைல் ஹேபிட்ஸ் இருந்திருக்கு, நான் டெய்லி யோகா பண்ணுவேன், நான் ஹெட் ஸ்டாண்ட் பண்ணுவேன், ஆனா மேரத்தான் ரன்னா, எனக்கு ஏன் பார்க்கின்சன்ஸ்? There is no answer, unfortunately. It is either something we are eating or something we are consuming in the form of pesticides or chemicals. It affects us. So இது ஏன் வருதுன்னு தெரியாது, இதுக்கு ஒரு சொல்யூஷன் இல்ல. வயசானவங்களுக்கு வருது, நிறைய பேர் தனியா இருக்காங்க, ஒவ்வொருத்தருக்கும் சிம்டம்ஸ் ஒவ்வொரு மாதிரி இருக்கு, and they have to all deal with this. So it's a very serious problem. நாங்க மட்டுமே இதை பத்தி பேசிட்டு இருந்தோம் இவ்வளவு வருஷமா, எல்லாரும் இதை பத்தி பேசல, எங்களுக்கு கேட்கறதுக்கே சந்தோஷமா இருக்கு. ஓகே ஃபைன், there are a lot of things happening now around PD. There is more help coming. இதுக்கு முன்னாடி ஒரு 2 வருஷம் முன்னாடி நாங்க குளோபல்ல எந்த டாக்டருக்குமே ரெஃபர் பண்ணதில்லை. But in the last year alone, we have referred many patients to global. So obviously the quality of doctors, movement disorder specialist யாருமே இருந்ததில்லை சென்னையில. ஆனா இருந்திருப்பாங்களா இருக்கலாம், பட் ரொம்ப நாங்க தெரிஞ்சு கேள்விப்பட்டு ரெஃபர் பண்ண அளவுக்கு யாரும் இருந்ததில்லை ஒரு 5-6 இயர்ஸ் முன்னாடி. இப்போ கொஞ்சம் ஜாஸ்தியா இருக்கு. இப்போ குவாலிட்டி ஆஃப் கேரும் ரொம்ப நல்லா இருக்கு மெடிக்கல் கம்யூனிட்டியில. So without the medical fraternity, we as a support community can't do anything. பெரிய ரிக்வெஸ்ட் வர்றதே, சுதா யாருமா பெஸ்ட் நியூராலஜிஸ்ட் சென்னையில அப்படின்னு. There is really no answer to this because there is no one best neurologist. Like PD, neurologist also differs. ஒவ்வொருத்தருக்கு ட்ரீட் பண்ணது இன்னொருத்தருக்கு அதே மாதிரி ட்ரீட் பண்ண முடியாது. ஆனா எந்த நியூராலஜிஸ்ட் நீங்க சொல்றத உட்கார்ந்து கேட்பாங்க, பொறுமையா இருப்பாங்க, அது எங்களால சொல்ல முடியும். ஆனா அவர் கொடுக்கிற மருந்து உங்களுக்கு பெஸ்ட் சூட்டடா இருக்குமான்னு சொல்ல முடியாது. So ஒரு நியூராலஜிஸ்ட ரெஃபர் பண்றதுக்கு நடுவுல we have to find out a lot of things. உங்க வீடு எங்க இருக்கு, இப்ப குளோபல் போனா உங்களால அவ்வளவு பே பண்ண முடியுமா, உங்க கண்டிஷன் அவ்வளவு சீரியஸா இருக்கா, இப்ப நீங்க போற டாக்டர் உங்களுக்கு நிஜமாவே ரொம்பவே பிடிக்கலையா, உங்க மெடிசன் உங்களுக்கு சுத்தமா உங்களுக்கு சூட்டே ஆகலையா, இதெல்லாம் பார்த்துட்டு தான் ஒரு டாக்டர் ரெஃபர் பண்ண முடியும். So we can't just like that refer a neurologist or any doctor for that matter. So there is a lot of work to do within the community, and thank you so much for a hospital at this scale to stand up and do work. Thank you very much.
Thank you so much, ma'am. Now let's hear from our patient, Mr. Sampath, about his experience of Parkinson's and his treatment at Clinicus Global Health City. Sir.
Good afternoon to all. I am Sampath, aged 63 years now. I am suffering from Parkinson's disease in the age of 50. I know Dr. Sudame, I know Ms. Sudame Yeppan from 2014 or 15. I think I am one of the earliest members in the Parivartan, and she was responsible for my decision to go for DBS surgery in the year 2019. She arranged for an interaction with the PD patient who was operated elsewhere, and also arranged for consultation with a neurologist from a different hospital. We used to attend monthly meetings conducted by Parivartan, in-person meetings. Only for the last 2 years due to pandemic, she's going for virtual meetings. Regarding quality of life, improvement in quality of life, I must say that DBS surgery has done tremendous changes in my life. You saw me walking to the staircase, to the dais. Before joining the hospital in October 2019, I was coming by wheelchair. Now I am able to walk. Earlier, my head was moving like anything, and movements were more. Now I am able to do root canal with a dentist, and I am able to go to a salon without shaking my head. I thank Dr. Nigel and Dr. Vikas Agarwal, who is no longer in our hospital, and the entire team neurology for the success of the DBS surgery. And appropriately, this function is being held today is the World Health Day. And the theme of Parkinson's Day this year is integrated healthcare. So the launching of a comprehensive Parkinson's disease clinic has rightly moved into the theme for the current year. Just morning I was Googling about World Parkinson's Day. The theme was integrated healthcare. A patient with 50 years old or above, maybe suffering from diabetes or some other illness, heart problem. So only a comprehensive health clinic like this or in a hospital, multi-speciality hospital can cater to the patient. Thank you all.
Thank you so much, sir, for inspiring us with your words. Now, I would request Dr. Nigel to hand over a token of appreciation to Ms. Sudha Mayappan, our chief guest, in recognition of her commendable, noble contribution to our society. It's now time to express our gratitude and recognize the resilience of our patients, the real heroes who have trusted us to take care of their health. I would like to request our patient, Mr. Padam Chand, to come on the stage and Dr. Praveen Chandar to felicitate him.
Huh?
Miss Gauri, please come up. I would request Dr. Satish Kumar to express token of gratitude. Miss Ramabai, I would request Dr. Arul to please come up. Mr. Sampath, I would request Dr. Ramanan to come forward and felicitate him. We have one more special guest with us. I would like to invite Miss Veni, Parkinson's caregiver and author of a book on Parkinson's, to the stage for receiving a small token of appreciation by Mr. Bhaskar Reddy.
Good afternoon, everybody. I'm highly honored to get this mentor from Global Clinicals. A special thanks to Dr. Nigel for inviting me to this particular function. I'm so happy that we have started a comprehensive clinic. This is really lacking all over. And as Ms. Sudha Mayappan said, the awareness is definitely increased. Actually, my husband had Parkinson's when he was just 48 in the year 1998. Bombay or Kerala, Chitra Tamil Nadu. So I chose Hyderabad, and I should thank Dr. Rupam Morgohain there at Nizam's Institute, who evaluated my husband, and he was a fit candidate for DBS, and he underwent DBS at NIMS. And the surgeon was Dr. Manas Panagrahi. And after that, I would say my husband remarkably had improvement. Post DBS, he was actually leading an independent life. And after that, of course, we had a non-rechargeable DBS at that point of time. So we had to replace pacemakers every. The first time we did it after 7 years, and the next after 5 years. That is when I approached Dr. Vikas Agarwal through Praveen Chandra. Incidentally, I know Dr. Praveen Chandra from his childhood. He is my son's schoolmate. So through him, I got an entry to Global Gleneagle, and that's where Dr. Nigel performed the battery replacement system at Global Gleneagles. So I'm thankful to you all. And what I would say is, we are only thinking about the Parkinson patients, but actually the caregivers, you know, they suffer quite a bit, and it's more of a burnout for the caregivers. I've been a support to my husband for the last 22 years. And of course, I finally lost him in this July 2020. He had suffered almost for 22 years. But he was an amazing person. I would say the grit and, the resilience, I am yet to see a person like that. Rose from bedridden to doing his own activities. That was quite amazing, and I thank each one of you. And I'm really honored for this. Thank you.
Thank you so much, ma'am. My sincere thanks to Ms. Sashi Vijayan and Ms. Bhumika for conducting a wonderful workshop for art therapy and physiotherapy. I would like to request Dr. Lakshmi Mishra to come up and present a token of thanks to them. Now, the session is open to media for some questions. Our clinical team will be happy to answer all your queries. Anyone having any query regarding the Parkinson's disease can come up and ask to our clinical team.
What would be the cost of DBS? How much it will cost now?
So the cost depends on two things. One is whether you use a rechargeable or a non-rechargeable battery. If you are using a rechargeable battery, which has got a lifespan of about 15 years, the cost will be approximately 15 lakhs. If you are using a non-rechargeable battery, which has got a lifespan of about 5 years, the cost will be about 11.5 lakhs. For everything, that's the full package, including the electrodes, the battery, the hospital charge, the scans, the use of all the equipment. That is the cost.
What's the difference between chargeable and non-chargeable?
So the non-rechargeable battery, you cannot recharge it. So it is used continuously every day. There's no need to recharge it. It has got a lifespan of about 5 years. After 5 years, you have to change the battery. The rechargeable battery, every week, depending on the usage, you have a charger which is given, which comes. You've got to put it there, and how you charge your phone, you charge the battery for the stimulator, and that has got a lifespan of about 15 years. So after 15 years, you have to change it. So 5 years versus 15 years.
Just tapping and charging method or a card? Something for recharge?
Yes?
For tapping or any card to insert?
No need for a cord. No need for a cord. You just put it over top over there, and it will recharge the battery.
The equipment is
The equipment which we are currently using is imported. It comes from the US. It's imported. So every 5 years it will be the cost of the battery plus the hospital package. It costs around 4.5 lakhs for the battery, rechargeable. The non-rechargeable battery is cheaper. The rechargeable battery costs 4.5 lakhs.
How much he has to spend for hospital?
For the hospital package will be around 1 to 1.5. So totally it will be around 5.5.
Subsequent subjects will be much less.
Yes, subsequent surgeries will be much less. It's only the initial surgery costs the highest. The subsequent surgeries after many years is much less.
How much it will reduce?
That's what for recharging, for putting a rechargeable battery, it will be around 5.5 to 6 the entire package. The cost of the battery alone is 4.5 lakhs.
Any insurance is covering?
Some insurances cover, some insurances do cover. They may not cover the full bill, but they do cover parts of the bill.
Hereditary is also reason for Parkinson disease. Hereditary also reason for this.
Yes, hereditary. Yes, there's about 10 to 15% of the patients who get it, it is hereditary. Hereditary does play a role in 10 to 15%, not all the patients.
Which category insurance will cover?
Category of insurance coverage, which
it depends on the age of the insurance, but on an overall note, insurance is covered. No, not yet. We have given our representations. Government has to act. The representation given on few years back. New government also we have sent a reminder. They may act.
They have money means not money means how
See, we have a schemes, organization also help the patients because the equipment cost itself is 4.5 lakh. hospital cost initially is 6 to 7 lakhs as a total program. We have done few cases, of course, half of the cost, other than the equipment. We do have that kind of provision. We do help the patients. Generally poor, generally non-affordable. We do help. Crowdfunding not yet, because crowdfunding largely supports the pediatric population. Not yet. Because the kind of the agencies also come with the mindset is largely pediatric population, not getting into this space. Thank you.
Thank you so much all. Now we have come to the close of the program. May I now call upon stage Mr. Bhaskar Reddy, Head of Corporate Relationships, to deliver the vote of thanks.
Thank you, Chief Guest, Ms. Sudha Mayappan, for gracing this occasion, and as well also doing this commendable job, of course, and our global salutes you for the kind of work you have been doing for the past many years. And the second, of course, the warriors today who trusted us, because many of the clinicians briefed about this is not the disease where we normally think it's simple like headache and fever. After a few doses of medication, it disappears. It requires a lot of programming, continuous follow-up, not by one individual or one specialist. If you look at the battery of specialists, there are 8 to 10 specialists are involved to giving us best of the best clinical outcomes. And thank you so much for trusting us. And third, importantly, the program director, Dr. Dinesh Naik. Let me tell you, I am yet to see a condition or a situation or the facility I am yet to see, wherein under one roof, running these kind of complex programs is not that easy. There are ample empty centers in across country. Simple neurologist can climb, they can see top to bottom, head to toe. But that is not the era currently we are living in and expecting for. Subspecialties is the focused area now. For a headache, people are looking for a headache specialist. Though he is a neurologist, they are mastered in headache. Epilepsy, probably ours is the only center for southern part of the country having done many miracles. People are looking for that kind of mindset. Stroke, though a neurologist can treat, it's not the neurology alone. There are again a complex system wherein starting from the nursing care, everything matters. Thank you so much, Dr. Naik sir, for giving us this wonderful pride. Probably this is one of the country's pride, I would say, because I'm yet to see this kind of system wherein under one tree, providing these kind of complex services and not compromising on quality. That has to be reminded, please. Best of the best clinical outcomes, not at all compromising on quality, and always, of course, fighting with management for patients' rights on a lighter note. That keeps happening every now and then. And this is the type of clinical, the galaxy of clinical team what we have. We are very proud to have you and, of course, entire your team, sir. And another important thing, we do see very scary, dramatic situations, especially the ECR OMR is called as a trauma bay. And that's the area also Dr. Dinesh Naik and NICE team has not compromised, though it is not related to PD. But the neurotrauma, neurorehabilitation, neurocritical care is one of the important aspects for patient recuperation and recovery. And that's where Dr. Ramanan plays a very pivotal role. And hats off to clinical, of course, critical care team as well. And of course, the media, and you have been all the time supporting us, sailing with us, listening to us, and spreading this kind of unique information for the benefit of people at large. Thank you so much for my colleagues, of course, clinical teams are around, non-clinical teams are around, always been looking for these kind of medical miracles. And fortunately, this facility became the hub for many of the medical miracles. Probably this is one of the miracle comes out of this medical miracles. Comprehensive PD clinic is not that easy, as I rightly mentioned. It's not done by one person or one neurologist. So thank you so much, sir, for giving us this wonderful experience. And all the best to the entire team and of course the warriors eagerly looking at the entire the process, entire the flow of the event, and wishing you all the very best from Gleneagles Global Health City, and requesting all of you to adjourn for a lunch being served next to this campus, next to this building. Thank you so much.
சார் டீட்டெயில்டாக பேசிட்டீங்க. எசன்ஸ் 1 to 2 minutesல இன்னைக்கு ஈவெண்ட்டோட ஸ்பெஷாலிட்டி மட்டும்
போகலாம் சார்.
இன்னைக்கு உலக பார்க்கின்சன்ஸ் நோய் தினம் 11ஆம் தேதி ஏப்ரலை முன்னிட்டு முன்னாடி கிளெனிகல்ஸ் குளோபல் சிட்டியில் பார்க்கின்சன்ஸ் நோயை ஒரு ஒருங்கிணைந்த ஒரு மூலமாக இங்கே எப்படி மேனேஜ் பண்ண போகிறோம்ன்றதுக்கான ஒரு தொடக்க விழாவாக இதை இன்னைக்கு நாங்கள் ஆரம்பிச்சிருக்கோம். இதை ஒரு காம்ப்ரிஹென்சிவ் கிளினிக்னு சொல்கிறோம். அதாவது ஒரே கிளினிக்கில் ஒரு பார்க்கின்சன் நோய் உள்ளவர் வந்தால் அவருக்கான மருந்துக்கான அசஸ்மெண்ட்டு, அதுபோக அதே பேஷண்ட்டுக்கு மருந்து இல்லாத மற்ற பிரச்சனைகளுக்கான தீர்வு, ஃபிசியோதெரப்பி, மனப்பிரச்சனைகள் இருந்தால் மனப்பிரச்சனைக்கான தீர்வு, அதுக்கான மருந்து, மற்றபடி அவருடைய நடைப்பயிற்சி எல்லாமே ஒரே நேரத்தில் ஒரே இடத்துல கிடைக்கணுன்றது தான் இந்த காம்ப்ரிஹென்சிவ் பார்க்கின்சன்ஸ் கிளினிக்குடைய ஒரு முக்கியமான ஒரு கோலாக இருக்குது. அதுக்கான தொடக்க விழாவாக தான் இன்றைக்கி நாங்கள் பார்க்கின்சன்ஸ் நோய் நாளை பொறுத்து அது 4 நாள் முன்னாடியே நம்முடைய குளோபல் ஹெல்த் சிட்டியில்
தெரியல. ரெடியா? ரெடி? தமிழில் பேசு. தமிழ் கொஸ்டின் நான் இங்கிலீஷ்லேயே போயிட்டு
எல்லாமே ஸ்டார்டிங் ஸ்டேஜ் என்ன அறிகுறி
இவர்கிட்ட ஃபர்ஸ்ட் அப்படியே வரேன் நான். சார் பார்க்கின்சன்ஸ் டிசீஸ்ன்றது எப்படி நம்ம கண்டுபிடிக்கிறது? யாராக இருக்குது?
Patients will have usually Parkinson's difficulty in walking. They will have tremors and they will have a tendency to fall down. They will have stiffness of all the joints. These are some of the early symptoms of Parkinson's disease.
இது பரம்பரை வியாதியா இல்லை எப்படி இது?
Only about 10 to 15% of them are hereditary. Most of the times we do not know what is the exact cause. Only 10 to 15% of them is hereditary.
எந்த மாதிரி குறைபாடில் இது வரும்? என்ன குறைபாடுலனால இந்த டிசீஸ் வரும்?
ஸோ பொதுவாக பிரெயினில் ரெண்டு விதமாக பிரெயின் வேலை பார்க்கும். ஒன்று ஒரு வேலையை பார்க்கணும்னு சொல்லணும், பாசிட்டிவ் ஃபீட்பேக். ஒரு பேனா எடுக்கணும் அப்படின்னா அந்த பேனா நான் போய் எடுக்கணும், பாசிட்டிவ் ஃபீட்பேக். அதுக்கு மூளை அந்த சிக்னலை கொடுக்கணும், நீ போய் அந்த பேனாவை எடு அப்படின்னு. பேனாவை எடுத்து முடிச்சதுக்கப்புறமா இப்போ நீ பேனாவை எடுத்துகிட்டா போதும் அந்த வேலைன்னு சொல்கிறதுக்கு நெகட்டிவ் ஃபீட்பேக். ஸோ ரெண்டுமே பேலன்ஸ்டாக இருக்கணும், மூளை கரெக்டாக வேலை பார்க்கணும். பட் இந்த பார்க்கின்சன்ஸ் டிசீஸில் என்ன ஆகும்னா நிறைய டைம் அந்த நெகட்டிவ் ஃபீட்பேக் இல்லாமல் போயிடும். ஸோ ஒரு வேலையை நம்ம பார்த்துட்டே இருக்கிற மாதிரி இருக்கும். அவர் ரொம்ப ரொம்ப நெகட்டிவ் ஃபீட்பேக் ஸ்டிஃப்னஸ் ஜாஸ்தியாக இருக்கும். ஸோ அதனால தான் அவங்க நிற்க முடியாமல் பேலன்ஸ் தவறி கீழே விழுறது, அவர் சீப் வாரம் நிறைய இன்கோஆர்டினேஷன் இஷ்யூஸ் அது மாதிரி நிறைய ஆகும். அதே மாதிரி இது ரொம்ப நிறைய ஏரியாஸ் எல்லாம் இன்வால்வ் ஆக ஆரம்பிச்சதுன்னா யூரின் போகிற கண்ட்ரோல் போகிறது அதெல்லாம் நிறைய வர ஆரம்பிக்கும். ஸோ பொதுவாக இது டீஜெனரேட்டிவ் டிசீஸ்னு மெடிசின் சொல்லுவோம். அந்த இடம் பழுதடைஞ்சு போயிட்டே இருக்குது. அப்போ அது வேலையை பார்க்க முடியாமல் போகும். ஸோ இந்த நெகட்டிவ் ஃபீட்பேக் கொடுக்குற ஹார்மோன்ஸ் நான் ரொம்ப சிம்பிளாக மக்களுக்கு புரியறதுக்காக சொல்கிறேன். இதில் நிறைய காம்ப்ளெக்ஸாகவும் இருக்குது. இந்த டோபமைன்கிற ஹார்மோன் அது மூளையில் சுரக்கும். அதை சுரக்காமல் இருக்க அந்த டோபமைனுடைய வேலை கம்மியாக முதல்ல என்ன பண்ணுவோம், மெடிசின்ஸ் கொடுப்போம். மூளையோடைய டோபமைன் அளவை ஜாஸ்தி பண்ணுறதுக்கு மெடிசின் எடுத்த உடனே யாருக்குமே சர்ஜரின்னு எந்த சென்டர்லையும் சொல்ல மாட்டாங்க. முதல்ல அந்த டோபமைனை ஜாஸ்தி பண்ணுறதுக்கான மருந்துகள் கொடுப்போம். அதே டோபமைன் மட்டும் கிடையாது, நிறைய கொலினர்ஜிக் ஹார்மோன்ஸ் கூட செக்ரேட் ஆகும், அதுவும் குறைபாடுகள் வரலாம். அதுக்கான மெடிசனும் கொடுத்து பார்ப்போம். ஸோ அந்த ட்ரெமர் எல்லாம் கம்மி பண்ணுவாங்க. அதெல்லாம் முடிச்சும் அவங்களுக்கு சரி ஆகலை. சில பொதுவாக மருந்தெல்லாம் ஓரளவு வரைக்கும் வேலை பார்க்கும். அதுக்கப்புறமா அந்த மருந்துக்கும் ரெசிஸ்டன்ஸ் அந்த ஸ்டேஜ் அவங்க ரீச் பண்ணும்போது சர்ஜரி தேவைப்படலாம். அப்போ தான் அந்த டீப் பிரெயின் ஸ்டிமுலேஷன் சொல்லுவோம். டீப் பிரெயின் ஸ்டிமுலேஷன் நம்ம என்ன பண்ணுவோம், அந்த சர்ஜரியில் அது ரொம்ப ப்ரிசைஸாக ரொம்ப துல்லியமாக பண்ண வேண்டிய சர்ஜரி அது. ஏன்னா அந்த பிரெயினுடைய அந்த ஏரியாவை மட்டும்தான் நம்ம ஆக்டிவேட் பண்ணணும். வேறு ஏதாவது ஏரியா ஆக்டிவேட் பண்ணோம்னா நமக்கு ரிசல்ட் தப்பாக வந்துடும். ஸோ பிரெயினோட அந்த ஏரியாவை மட்டும் ஆக்டிவேட் பண்ணுற மாதிரி சர்ஜரி. இதுக்கு வந்து பேஷண்ட்டோட கோஆப்ரேஷனும் ரொம்ப முக்கியம். அந்த அசஸ் பண்ணுற நியூராலஜிஸ்ட்டும் கரெக்டாக அசஸ் பண்ணணும். அதுக்கு பண்ணுற சர்ஜனும் எல்லாமே சேர்ந்து வந்தால் தான் அதோடைய சக்ஸஸ் ஜாஸ்தி. நியூராலஜிஸ்ட் நல்லா அசஸ் பண்ணார், சர்ஜன் சரியாக அப்படின்னா தப்பான ஏரியாஸ். ஸோ இது வந்து நிறைய பிளானிங் எல்லாம் நடக்கும். முன்னாடியே ஒரு எம்ஆர்ஐ பண்ணுவோம். அந்த எம்ஆர்ஐயில் வந்து உட்காந்து டீட்டெயிலாக நம்ம மெடிக்கல் டீம் வந்து அதை அனலைஸ் பண்ணுறோம். எந்த ஏரியாவை கரெக்டாக நம்ம ஸ்டிமுலேட் பண்ண வேண்டியிருக்கும் அப்படின்னு. அது வந்து 1 millimeter தான் எரர் நம்ம அலோவ் பண்ணுறோம். மேக்ஸிமம் நம்ம அலோவ் பண்ணக்கூடிய எரர் 1 millimeter. ஸோ அந்த நியூரோ நேவிகேஷனுங்கிற சிஸ்டம் வச்சு முன்னாடியே சர்ஜரிக்கு முந்தினாலே அந்த எல்லா டீமும் உட்காந்து இந்த ஏரியாவை நம்ம இது பண்ணணும் அப்படின்னு ஆக்டிவேட் பண்ணணும்னு முந்தின நாளே நம்ம வந்து பிளான் பண்ணி அதுக்கு அடுத்த நாள் ஆப்ரேஷன் போதும். அது அந்த ஃப்ரேம்னு சொல்லுவோம், ஸ்டீரியோடாக்டிக் ஃப்ரேம்னு சொல்லுவோம். அது வந்து 3 ஆக்சிஸ், எக்ஸ் ஆக்சிஸ், ஒய் ஆக்சிஸ், ஜெட் ஆக்சிஸ், 3 ஆக்சிஸ்லேயும் நம்ம எந்த அளவுக்கு எரர் இல்லாமல் துல்லியமாக இந்த லீடை வந்து வைக்கிறோம், பேஸ் மேக்கர் லீடை வைக்கிறோம் அப்படின்னு நமக்கு துல்லியமாக சொல்லுவோம். அதெல்லாம் முடிச்சு 2 லீடு இருக்கும் அந்த தேவையான ஏரியாஸ். இந்த லீடை வச்சதுக்கு அப்புறமா கூட ஆப்ரேஷனே இந்த பேஷண்ட் வந்து மயக்கம்லாம் ஃபுல்லாக கொடுக்க மாட்டோம், ஜஸ்ட் தூங்க வச்சுருக்கோம். அவ்வளோதான். அந்த லீடை வச்சதுக்கு அப்புறமா திரும்ப நம்ம பேஷண்ட்டை அவேக் பண்ணி அந்த கை கால் மூவ் பண்ணுங்க, பேசுங்க. ஏன்னா இந்த ரொம்ப ஸ்டிமுலேட் பண்ணிட்டோம்னா பேச்செல்லாம் போயிடும். ஸோ கரெக்டான அளவு மட்டும்தான் பண்ணணும். அதுக்கெல்லாம் பேலன்ஸ்டாக பண்ணி அந்த சர்ஜரி போதே அந்த லீடை வச்சதுக்கு அப்புறமா திரும்ப அவங்கள அசஸ் பண்ணி அவங்க நல்லா இருக்காங்களான்லாம் செக் பண்ணிவிட்டு அதுக்கப்புறமா தான் நம்ம பேட்டரியை.
இப்போ வந்து எல்லா நரம்பு தளர்ச்சியும் பார்க்கின்சன்ஸ் அப்படி கிடையாது.
ஸோ அதாவது நரம்பு தளர்ச்சி ஃப்ரீக்வெண்ட், சீக்கிரம் அடிக்கடி விழுறது, வீட்டில் கையில் ட்ரெமர், கை நடுக்கம் இருந்துகிட்டே இருக்கிறது, இதெல்லாம் ஏர்லி சிம்டம்ஸ்னு சொல்லுவோம் நம்ம. அது மாதிரி இருந்ததுன்னா நீங்கள் வந்து உங்களோட நியூராலஜிஸ்ட்டை போய் கன்சல்ட் பண்ணணும். இது பார்க்கின்சன்ஸ்
உட்காந்துட்டு வச்சு வந்து டிவி பார்க்கும்போது கால் ஆட்டிக்கிட்டே ஒரு மாதிரி ஹேபிட்ஸ்லாம் இருக்கும்,
அதெல்லாம் பார்க்கின்சன் கிடையாது.
அதெல்லாம் பார்க்கின்சன்ஸ் கிடையாது.
பட் அது பார்க்கின்சனா பார்த்துக்கணும், அவ்வளோதான். நம்ம கண்ட்ரோல் இல்லாமல் நம்ம பண்ணுறது.
டோபமைன் வந்து அது வந்து எப்படி நீங்கள் வந்து இயற்கையாகவே நம்ம வந்து ஸ்டிமுலேட் பண்ண முடியாது, கொஞ்சம் அதோட இது அதிகப்படுத்தி இன்க்ரீஸ் பண்ண முடியாது. என்ன மாதிரி
ஃபிசியோதெரப்பி எல்லாம் பண்ணி அதோடைய ப்ராக்ரஸை வந்து கொஞ்சம் ஹால்ட் பண்ணி வைக்கலாம். பட் அதுக்கு கம்ப்ளீட்டாக நம்ம க்யூர் பண்ணால் கொஞ்சம் மருந்து மாத்திரைலாம் எடுக்கலாம். சுகர் மாதிரி தான், இயற்கையாக இன்சுலினை ஜாஸ்தி பண்ணுறதுக்கு நம்ம வழி பண்ணலாம். பட் அது தாண்டி போகும்போது நம்ம அதுக்கு டேப்லெட் எடுத்தால் அது மாதிரி இதுவும்.
இது தவிர்க்கிறது உணவு முறை முக்கிய காரணமா இல்லை நம்மளோட சேர்ந்த கெமிக்கல், அதாவது உணவு முறை இதை வந்து வராமல் தவிர்க்க என்ன பண்ணலாம்?
வராமல் தடுக்கிறதுக்கு உணவு முறை, நல்ல எக்ஸசைஸ், ஃபிட்னஸ், ரெகுலராக நம்ம வந்து நம்ம எல்லாமே வேலை பார்க்காம வச்சுருந்தா பழுதடைஞ்சு தான் போகும். அதனால எல்லாம் பேலன்சிங் சிஸ்டம்ஸ் எல்லாம் நல்லா ஒர்க் பண்ண வச்சுட்டு இருந்தோம் அப்படின்னா ஓரளவுக்கு தான் தடுக்கணும்.
வந்து டோபமைன் வந்து அந்த கம்மியாகிறதுனால இந்த டிசீஸ் சொல்கிறீங்க, இது ஹைப்பர் ஆயிடுச்சுன்னா
asking dopamine is less, so it's Parkinson's. It's increasing. அந்த மாதிரி டிசீஸ் இருக்காது. கோரியா அதெல்லாம் சின்ன வயசுல.
இது வந்து எந்த மாதிரி உணவு வகைகளை வந்து எடுத்துக்கலாம், எடுத்துக்கூடாது ஒரு ஏஜுக்கு அப்புறமா?
அப்படி உணவு முறைன்னு ஒன்றும் நல்ல உணவு முறை அவ்வளோதான், வேற ஒன்று ஹெல்த்தி ஃபுட் ஹேபிட்ஸ்னு சொல்லுவாங்க.
தேங்க்யூ.